Are you familiar with endometriosis? Since we rarely see endometriosis properly addressed and talked about, we'd like to devote this week's video to this ongoing issue. It presently affects about 1 in 10 women, and it's giving many of them reason to despair over their future health and fertility. Endometriosis is a disorder of female reproduction characterized by the outward growth of lesions that resemble endometrial tissue. Because these lesions can spread to other organs including intestines, ovaries, and fallopian tubes, they can cause severe discomfort. Endometriosis is now treated with a few traditional methods. A surgical procedure to remove the endometrial lesions that have formed. This has the potential to restore fertility and significantly lessen discomfort. However, the likelihood of the lesions reappearing is increased. In fact, within 5 years, there is a 50% chance of their coming back. Hormonal suppression comes in a variety of forms and can help reduce the rate at which the lesions spread. However, this has many negative effects on women since it often promotes estrogen shortage, which can lead to depression, bone loss, and other symptoms caused by excessive levels of testosterone and other androgens. This is then the root cause of such symptoms as excessive hair growth, greasy skin, acne, and so on. Mirena, a hormonal IUD, has emerged as a popular new treatment option. However, unlike other hormone suppressor skin, this may still leave women with some estrogen in their bodies despite suppressing the uterine lining and endometrial growth. These treatments can alleviate the pain that is an absolute priority for endometrial patients because it can be so severe, and so you're not getting all those dreadful symptoms like you were with a hormone suppressor. Unfortunately, traditional treatments for endometriosis are falling behind the latest scientific findings and do not deal with the disease's underlying causes. Firstly, it's important to understand that hormones aren't the root cause of endometriosis like they are in other conditions like PMS and PCOS. Endometriosis is a condition characterized by inflammation, and hormones can significantly alter the course of the illness. Inflammation is the primary factor in both the development of lesions and their pace of expansion. These natural treatments are effective because they reduce inflammation and help modulate the immune system so that it functions as it should. This slows down the growth of lesions, and in many cases, it can prevent their growth altogether. This is what we know from taking a holistic approach to disease. They are most effective when used after surgery has been performed to remove any pre-existing lesions. This allows patients to begin treatment with a clean slate and focus on reducing the risk of recurrence. Number 1. Intrinsic Progesterone. An integrative practitioner is the only type of doctor who is likely to prescribe this, but only if you have access to one and are comfortable having this talk with them. Since natural progesterone directly reduces the growth of the lesions and powerfully modifies the immune system, it may be the finest treatment available. Thus, it is recommended that you consult an integrative physician if you are interested in trying it. Number 2. NAC. This is short for N-acetylcysteine and is another useful antioxidant for the body. The fact that NAC was found to be more effective than hormonally based techniques in treating endometriosis in women without negative side effects. Number 3. Turmeric. Everyone here has probably heard of turmeric. Sadly, you can't obtain the therapeutic dose you need from eating it fresh, despite the fact that it has wonderful anti-inflammatory effects on the body. You should definitely take this with a pill or capsule. The exciting news is that turmeric has been demonstrated to minimize the size of pre-existing lesions in the body. It can reduce the size of these lesions without requiring surgery and can limit their growth by preventing estrogen from activating the tissue. Number 4. Zinc. inflammatory markers and cytokines can be lowered, thanks to zinc's ability to act as a control panel for the immune system. Amazingly, it also helps the gut by fixing the intestinal permeability, which has a direct bearing on the immune system. Intestinal permeability and zinc insufficiency were found to be more prevalent in endometriosis patients in a single study. Number 5. Having to stay away from dairy and gluten, cheese, and wheat. Improve inflammatory indicators and interfere with immunological function. 75% of women with endometriosis reported significant improvement after 12 months of following a gluten-free diet. The power of nutrition to influence inflammation and the immune system shouldn't be understated. What you eat has a direct effect on how much inflammation is happening in your body. Number 6. Take out the sugar and coffee. We'd like to add caffeine and refined sugar to this list if you are one of the endometriosis sufferers who experiences extreme pain, as these are two really key foods that, when removed substantially, may dramatically improve endometriosis. Number 7. Probiotics. You've probably heard of probiotics, which brings us to our next point. All studies have also linked endometriosis, which is basically an imbalance in your good and bad bacteria in your gut, and probiotics are one that helps to restore intestinal permeability. Intestinal permeability, which in turn improves immunological function and decreases inflammation. Specifically, less species of lactobacillus were detected in the guts of women with endometriosis, leading researchers to believe that supplementing with lactobacillus could inhibit the development of endometriosis. Number 8. Antioxidants, vitamins E and C. This is helpful for people who are deficient in antioxidants and those who are sick, reducing pelvic discomfort associated with endometriosis is a top objective. And this study found that supplementing with vitamins E and C significantly lessened the severity of pain experienced by women with the condition. Well, what we mentioned should be the first line of therapy, including maybe surgical removal of those annoying lesions. But we honestly don't know why you aren't being told of this as you leave the hospital or doctor's office. If the proof is there, it's incredible what eliminating a few foods from your diet can do for you. If you're already taking one of the more standard remedies we suggested and it is helping you, then by all means, keep doing so. Women with endometriosis need to be aware of the state of the science. Therefore, if you know any, please send them a link to this video. And by the way, the information contained in this video is not intended to be a substitute for professional advice, so make sure to ask your doctor if you have any concerns about a medical condition. If you can relate to anything we've stated here, or if this video has been helpful to you in any way, we'd really appreciate it if you'd leave a comment and give it a thumbs up. If you enjoyed this video, make sure to subscribe to our channel. Thanks for watching.